Hi, I'm Barnstable County Commissioner Bill Doherty, and it's my pleasure to welcome the viewers to another edition of County Chatter. County Chatter is a program that's intended to give the viewers here on Cape Cod, both visitors and year-rounders, some idea of some of the regional programs that are available to, here on Cape Cod. With me today to discuss Duffy Health Center's Emergency Department project are our good friends Susan Parent, Chris Parent, and Heidi Nelson. Heidi Nelson is the Executive Director of Duffy Health Center, and I thought we might start off by giving the general overview. What is the mission of the health center, and what population you're serving, and how many people do you serve, and all those kinds of questions.
Sure. Bill, thank you so much for inviting us again to be on the program. We always love to come and visit with you. The mission of Duffy Health Center is to prevent and end homelessness through health care. We have a unique blend of services on Cape Cod that include a medical clinic, mental health and substance abuse counseling, and case management services that help our clients to find housing and keep housing. The last time we checked our data over the last year, we served 3,800 people over the last 12 months. And when I use that number on the Cape, people think, oh my goodness, there are almost 4,000 people who are homeless on the Cape, but many studies show that we have upwards of 6,000 people who experience homelessness on Cape Cod over the course of a year. And if we count other folks who are very low income and who are unstably housed or tenuously housed, that number times 3. So close to 20,000, 21,000 people are eligible for Duffy Health Center services. Also, that 3,800 number is about 50% greater than the annual number of people that we were serving just 3 years ago. Mm-hmm. So that's our place in the service system on the Cape, is really to attract people into our services because they need medical care, and identify through those services, we identify needs for mental health counseling and for substance abuse treatment, and help people get on the road back to a life of recovery.
Well, in recovery, you obviously need partners with the rest of the healthcare community. So how do you interact with the Cape Cod Healthcare?
Sure. Well, and that's what we're here to talk about today, is a wonderful new project that we're engaged in with Cape Cod Healthcare. But our partnership with the hospital has been over the last number of years. We've partnered with the hospital, and it's a very, very important collaboration for us. We've talked in the newspaper, we've talked in other places about the critical shortage that we have of healthcare providers on Cape Cod. And so one of the things that the hospital helps us with is recruitment. Jolia Georges and the people at the hospital, Keith Ritchie, who work on recruitment of providers, we work together to bring new doctors and nurse practitioners and physician assistants to the Cape. The hospitalists, some of the physicians at Cape Cod Healthcare cover for our doctors in the after hours, so in the evenings, nights, and over the weekend, they cover our patients for us.
I think that people, I did not know what a hospital was, and I've been sitting on a patient and family advisory committee, mm-hmm. and people should be aware that although the hospitalist
mm-hmm.
is serving in lieu of your primary care physician, that the primary care physician isn't always directly notified. So people should be aware of their personal responsibility of making sure their primary care physician knows that that their loved one is in the hospital, so that they're aware that that is going on.
Well, and I think it's important also to add, though, that the community health centers all have electronic connections, and that's another one of our partnerships with the hospital. So our providers can go on to the hospital information system, and we can get messages from the hospitalists and other doctors in the hospital about our patients and the care that they're receiving there. The hospital also does the very important function called credentialing checking for our patients, so to make sure, for our physicians, to make mm-hmm. sure their licenses are up to date and things like that. Very importantly, the 4 health centers on Cape Cod all participate in what's called the Community Benefits Program for Cape Cod Healthcare. You may not be aware, but all of the hospitals in Massachusetts, there's a state law that when they build a new building or they purchase a new machine, that they have to make a contribution to services in the community. And so they have a grant program through Cape Cod Healthcare where they set aside funding when they build something new and make contributions to community providers. So all of the health centers receive regular funding from Cape Cod Healthcare as well.
And then the funding for your emergency department.
So I'll go right into that now. Actually, we have partnered with the hospital for many years around the emergency department. We have very good communication with the doctors and the nurses in the hospital emergency department. Again, we get notifications when our patients show up in the emergency department, but it's been very informal. And for a long time, we've wanted to really have a funded program to work with the hospital to really tackle the issue of the people who come to the emergency room repeatedly and rack up a lot of healthcare costs by using the more expensive emergency department and coming time and time again because they're not getting regular primary care. And so we've wanted to, we've partnered informally, but this has been our first opportunity to have a formal partnership. The funding came from the federal government, what's called the Center for Medicaid and Medicare Services. So it's the Health and Human Services Department of the federal government. And what they wanted to do, it's called an innovation grant, and they awarded grants all across the country for community health centers, hospitals, public health associations, and other groups to do innovative projects to try to save the health system money. Duffy Health Center belongs to an organization called the National Healthcare for the Homeless Council. So we have a National Association of Healthcare for the Homeless providers just like us who are all over the country in San Francisco, Los Angeles, Denver, Chicago, Miami, San Antonio, New York City, all over the country. There are over 200 HCH projects. So our National Association applied for one of these innovation grants, and they asked our projects who wanted to be involved in this national demonstration project, and Duffy Health Center said yes. We've always wanted to have a better partnership with our hospital, so we'd like to be one of the 10 healthcare for the homeless projects across the country that partnered through our national association to write this proposal, and we got the funding. It was highly competitive. There were as many as 10,000, I think, applications that went in for this funding, and it was less than 50 that have actually been funded across the country. So we're very proud to be a part of this prestigious national program.
Well, that is amazing to me, and you've already identified, the national partners. Now here we are with a program in place, and you obviously have to have people to flesh that out, and your two community health workers,
Susan and Chris, right,
are doing this. So, Susan, I've known you for a while. But what kind of training did you have to get in order to qualify for this?
Well, we had extensive training through webinars through the National Healthcare for the Homeless Council. We had probably about close to 20 different webinars, which are seminars over the internet. And we learned about everything from ethics to chronic diseases and the role of the community health worker, which has gone on for centuries and centuries. And we've gone to conferences at the National Healthcare for the Homeless Council, the National Conference, and as well as the Northeast Regional Conference last year. We have had extensive training,
wow.
Trauma-informed care.
Yeah. When you go to these conferences, what are the kind of takeaways that you come back with?
Well, we learn about different subjects that are pertinent to our jobs, but we also have camaraderie amongst the other community health workers that are working under this grant. As Heidi said, there are 10 different sites, completing this, working on this grant with us. So we get to meet and bounce ideas off of the other community health workers as well, and learn from a community health worker that has been in the field for quite a while. His name is Sergio, and he's been running a lot of the seminars that we've had, and so we're learning from the best and learning with each other, and it's really helpful.
Networking, you're learning networking at a very basic level.
Yes.
I think all of us have found out, in our so-called careers that if you can talk to somebody that does a job similar to your own, you can get a lot they can use, especially in the part, well, I tried that and it worked this way, and I would have done it a little bit differently. So you've learned that.
Definitely, yeah.
Now, you know, Chris, the emergency department is something that I think all of us have a sort of a general familiarity with, and it's kind of a scary place in a way, because when you go into the emergency room, you're usually in desperate need for, you know, for services and care. So how do you, as representing Duffy and that population, how do you work with the emergency department?
Well, in the beginning, I went over to and get involved with other social workers that work in the ER department there. And after a while, I was intimidated myself in the beginning. Because, I mean, I never really cared for hospitals anyways. I'm not sure who does. But after I got to meet the social workers that I worked with, I became a lot more comfortable with clients and doctors. And what we do is we track clients that are in use and abusing the ER. And from there, we go off of what our bosses or our social workers tell us what to do. And from there, we get a list and we attack the list. Susan and I.
Well, I worked my way through college at Cambridge City Hospital. Met my wife there, as a matter of fact. So I have a sort of a general idea of hospitals and you know, some of the dynamics that go on there. And hospitals are people by people, and people have good days and bad days, and sometimes that's one of the things you have to think about as you go on. Well, Susan, what? You know, we've talked about the connection, your training. How do you outreach to the community? How do they know how do they know enough to get a hold of you?
Well, usually the first thing I do is try and give them a call. And if I can't find them by phone, because a lot of people, you know, with low income, your cell phone gets turned off because you can't afford the bill, or you know, you don't have a phone.
Or your battery wears down.
Or your battery wears down if you get to charge it. That happens. So sometimes I'll outreach them. I'll go to a soup kitchen or the Noah shelter to look for them, or different places within the community that I know people tend to gather. Bay Bridge Clubhouse, the Village Green on a nice day. Just anywhere that people are likely to convene, you know, we'll look for people there and see if they need help.
Well, I've noticed that over at the town hall in Barnstable, there's apparently a group that are sort of gathering for commercial purposes of illegal substances. Or if you take a look at the building, sort of, they happen to be under, I think it happens to be congregating underneath the town manager's window, and then when he noticed it, he got really upset about it. So I wonder if that's reducing the population on the green. But that's
so we do have a community-wide collaboration around Main Street in Hyannis that is really a model that could be adapted by the whole country, I think, in particular resort areas where we have human service providers, the merchants, the Business Improvement District and the Hyannis Area Chamber of Commerce partner with us, law enforcement, Barnstable PD, and government officials. So there's representatives from Dan Wolf's office and from other government offices on our committee. And we work together, and we've actually reduced the amount of vagrancy on Main Street in Hyannis. Regularly, 3 or 4 years ago, there were upwards of 93 people who were hanging out on Main Street. And through our collective efforts, we've reduced that to a list of less than 25 people.
And you've identified who they are.
Absolutely. And there's a policy level group, and then there's a kind of a street level group of the people who actually work with the clients. And they're the ones who know the folks by name, and we gather our forces together, and we work to help these folks accept services and come over to Duffy Health Center so that they can start to make change in their lives. Well, there are always new people who come on the scene. Always new people are coming on the scene, I don't think we're ever going to be able to stop that. But what we have done is really figured out a way how we can all work together to improve the quality of life for everybody in Hyannis.
Well, that's certainly one challenge. I wonder if there's some others.
We have, I know a challenge that I deal with is clients' health a lot of clients do die, and that's an issue.
Well, there's always the conversation about how folks that, for example, are suffering from mental illness sometimes have their physical needs, sort of passed over because they present so often, in the emergency room, and sometimes the physical ailments, tend not to be, I won't say taken as seriously, but they're not able to communicate the difference between decompensation and a physical disability or physical problem. I wonder how you deal with that.
Susan and I work together, which is huge, because there are areas her strengths take over that I'm weak at, and then there's areas where she's weak and my strengths will help her. So I'm in constant contact with Susan every day, and that's about both of our clients that we have. So if I have a question and I don't know what to do, I'll call Susan.
How many people are you dealing with?
Right now, between the both of us, about 10, 10
Yes.
11. Yeah.
Yep.
Okay. Well, span of control says 5 apiece would be ideal, but and hopefully there's a certain amount of rotation that goes through that, so you're able to transition people to a place where they have some stability. How long have you been doing this?
The grant started about a year ago, a little over a year ago. We started training in November, I believe,
2012.
of
Yeah.
2012. So for about 6 months we've been working.
Okay. Now, when it's very important that you've said that you're working together, because that's the basis of teamwork, is to
Yes.
recognize both your capabilities and limitations, and and downplaying what some of us in business used to call about suppressing your ego in order to get the job done. So it's obviously you understand that piece of it. What are some of the other things that you've noticed that you could use some more help with?
I've found that working under a grant, there's an extensive amount of paperwork.
Welcome to our world.
Yes, and
Medical terminology.
the medical terminology can be quite different, as well as the repetitiveness of some of the paperwork, having to ask people questions, the same questions every few months, and some of the questions can be quite difficult for clients to answer because of past traumas or past history, and I found that can be a bit of an obstacle or a barrier to them being willing to stay on the project with us.
Can you give me an example?
The reason that we ask the questions periodically is because this is part of a research project. So there is a research protocol, and we have to interview all of the clients. There's an intake interview, and then they're re-interviewed at different steps along the way, so that we can demonstrate or not, looking at the quality of life of the individuals to see if their situations have improved.
Well, that used to be called was a success on a learning curve. As far as adaptability to let's say, to clinical support. How you been doing?
We're doing well with it. It's a learning process for Chris and I also. This isn't an area that I've worked in before, so I'm learning as we go, and I think that the clients are getting a lot out of what we do. So I think it's going very well so far. It's a good project to be working for.
The goal is really to look at this list of people, again, as Chris and Susan mentioned, that the hospital has the data to identify who are the people who are frequent users of the emergency department. And some of them have had contact with Duffy in the past, and some of them have not. And so a success, and we've had some, is when somebody is able to, when they agree to come to Duffy and to start to receive care from one of our primary care providers. You guys were telling me about a patient who's now seeing one of our providers at the health center, somebody who for years and years and years has not come into the health center, who actually happens to be somebody who's very, very ill and probably will die. And that's one of the things that Chris was mentioning, is the really hard part of this is often folks are on this list because they're coming in so often because they're in medical crisis a lot, and in some cases we're not able to stabilize that. But if we can have them come into Duffy rather than going into the emergency department, we're saving the system money, and we're creating really a patient-centered medical home for the patient to come in where somebody knows them, knows their history, and can really provide time and a caring environment for them to receive their care in.
We used to refer to that as was it establishing a therapeutic liaison in order to, let's say, in order to give successful support in a sustainable way to people, and it's very important. The emergency room is peopled by different people at different times, and there's that element of learning the connection over and over again. So that that piece is very important, and I hope that the people who are watching that, watching this program, would appreciate the fact that that is going on. Matter of fact, the quality of that connection is one that could be well emulated, or what I'd call in the private sector, those folks who can perhaps afford let's say support either through insurance or through personal funds, but there never seems to be enough understanding that there is a continuity of care that that's based upon a trust in the connections that are being made, and I wonder if you've begun to find that out in your service.
I've seen, well, I have to honestly say, this is a new job for me, new environment. I'm used to the trade. I was in the trades for years, and now being in healthcare, I'm very grateful that I have certain nurse practitioners and doctors that I work with. I'm lucky to have Susan, because a lot of the people that I have to do advocacy with and just interact with, I would probably never have been able to do it before if it wasn't for Susan saying, why don't you not attack this person, but go at this person with this type of a mentality. So I have to say that I wouldn't be where I'm at right now if it wasn't for people at Duffy.
Well, don't dismiss having worked in the trades, because those of us who have both worked in the trades and supervised people, as far as direct personal contact or human contact, is, as you know, there's a love affair that begins with a customer at the beginning of a project that goes through several stages.
The customer's always right?
Yeah, well, I was told that if you're 50% for the customer and 50% for the company, you're 100% for yourself. So you probably have learned that over time. Susan, what did you do before you got involved with Duffy?
Before Duffy, I believe I was working as a liaison between Baybridge Clubhouse and the Business Improvement District, doing administrative work for the clean team position at Baybridge. And I met HEIDI at a Business Improvement District meeting for all of Main Street for the merchants and concerned citizens to come together and discuss different problems that were happening on Main Street and how to address them and how to address people who were disruptive to customer service. And I spoke up on a couple different issues and also let people know that I was interested in employment.
Well, Susan, your speaking up is something.
At the meeting, I said, and I have a job for you.
Yes, you did.
Hoorah.
It's perfect timing.
Yeah.
Well, I think that's wonderful, because I've known Susan over time, especially in your role, with helping out at Baybridge, and I've always felt that perhaps your most important contribution is that you weren't bashful about speaking up, and I think that's a good thing that that you're able to move into that.
Thank you.
Now, you have a project, you've been working on it, for a year, with grant programs. One of the biggest problems with any government program is that you're always facing that time when either the known date or, unfortunately, the unscheduled date, where the money goes away. What do you expect will be the outcome of your emergency, department project?
I think that the position as a community health worker will be valued, and I hope to find that more community health workers are added to the workforce. hopefully there'll still be a position for me at Duffy. And but I think that our position will be duplicated in other places as well. People will see the value in the work that Chris and I do and other people around the country, because it's a unique position that draws on both experience and education. And that has a lot of value, because we can not only teach clients from what we've learned, but we can empathize with them at a level that some people can't in the healthcare community.
Susan, there's nothing that is more important than hearing from somebody who's in the trenches as far as what's going on. And I've seen that, in many different jobs and positions that I've had, is that people pay attention to someone who actually has had the direct contact with, and has worked in the field. Mm-hmm. There are a lot of theoreticians who have ideas. We all sit around a table. We've read a book, and we have I'd say a concept of how to go on, but nothing replaces that direct practical experience, which will stay in you good stead. And I have to say, from my own experience, when I was working at Cambridge City, hospital many years ago, I still remember the lessons that you learn, that when a person is suffering, you get to see exactly who that person is, because in pain you can't hide what's going on, and it gives you what I'd call an insight that that you'll find to be very helpful no matter what you do. Okay, so now we're going to go on to the future. And Heidi, this is, you're the director over there. As I said the last time, this would be your opportunity to, let's say, to offer a little bit of a pitch to the community as far as what they can do to be helpful to, to the mission that, that Duffy has, and the work that you're trying to do for the whole community.
Sure. Well, and just to add to what Susan said about the outcomes of this particular project, I think there always has been an assumption that if people were cared for in community settings as opposed to the emergency department, that it would be a more cost-effective model and save. That's why Medicare and Medicaid is funding this research study. So by the end of the study, we'll have a better idea of whether or not that's actually true, and if it's true, what's the extent to which that is true. But I think to say what we bring to the table is really that we really do end homelessness for the people that we serve. We are not a Band-Aid. We provide solace and support, but we also move people along and help them to achieve their life goals. That's one of the skills that Chris and Susan learn, is called motivational interviewing. What is it that you want in your life? Not what I want you to do, but what you want, and let's work together to try to get to that place
and
together.
Indeed, in doing that, they would develop the inner strength that would help them stay there and become, say, more productive and perhaps accomplish some of the life goals that that they might have. So I think that's a wonderful thing. As in all of these things, this time goes pretty quickly, and we're now at the at the end of it. And I would like to thank all of you for for coming, Heidi, Chris, and Susan, and that. And I hope that the people who are watching get some sense of something that's going on in the community that is actually making a significant contribution on a day-to-day basis, not only to improve the quality of life for folks, but also to give a life with quality to the people that they're working with. Because one of the most important things is food, shelter, and then then getting on with employment and becoming as productive as we're meant to be. So with that, I want to thank my guests, and I want to thank the viewers for watching another edition of County Chatter.